You went to bed last night feeling completely fine. No chest pain, no dizziness, and no warning signs. Yet while you were asleep, your brain may have been experiencing restricted oxygen flow because of head position. This needs to be heard carefully because what is about to be shared has nothing to do with diet, nothing to do with exercise. Your doctor has probably never brought it up during checkups. The wellness doctor has spent years reviewing cardiovascular research. One silent pattern has been observed that almost nobody talks about. The way you sleep, the angle of your neck and spine position, actively influences how well blood reaches your brain every night. The Senior Wellness Hub wants you to understand this clearly. Stroke risk peaks in the morning hours after waking, with a 49% increase between 6 a.m. and noon, driven by the morning blood pressure surge that is no coincidence. What happens during sleep directly affects your vulnerability. Before you dismiss this and say you have slept this way forever, it is important to stay focused on the coming discussion. 6 sleeping mistakes will be walked through from harmful to dangerous. Then 2 evidence-backed positions will be shared for better health. Drop a comment below and tell if you are a back sleeper, a side sleeper, or a stomach sleeper, as all 3 matter. Your answer will be referenced throughout this discussion. Understanding the why behind these issues is very important. When you are young, your blood vessels are elastic and adapt. They stretch and compensate even in weird sleeping positions. But after 60, arterial walls begin to stiffen significantly. Small vessels feeding the brain become less flexible over time. The pressure inside your skull becomes more sensitive to position. Blood pressure regulation becomes slower, especially at night. Healthy sleepers experience a natural 10 to 20% drop. This dip is protective and allows the body to recover properly. If your sleep position is wrong, it disrupts this natural dip. It compresses vessels, restricts airways, or tilts blood flow wrongly. What fills that gap becomes far less friendly for your health. This framework should be kept in mind throughout the discussion. Sleeping fully flat without any head elevation sounds harmless. No pillow or just a thin one keeps the body perfectly horizontal. It sounds ideal, and many websites praise this position. But there is a critical piece that nobody is showing you. When you lie completely flat after age 60, blood distribution changes. Cerebrospinal fluid can pull, and intracranial pressure edges upward. Tiny vessels in the brain stay under extra pressure for hours. Even 15 degrees elevation improves nighttime blood flow dynamics. You may wake up at 3 a.m. with a dull, throbbing headache. It could be behind the eyes or at the base of the skull. Many think it is just aging and take water or ibuprofen, but it may be the brain signaling too much pressure inside. The fix is a simple 15-degree elevation of the upper body. Stomach sleeping is the position that twists everything badly. It feels harmless, but the neck faces the real problem here. You rotate your head to one side, usually the same side nightly. Your neck stays rotated up to 90 degrees for many hours. Vertebral arteries that supply the brain stem get kinked. Flow becomes restricted like stepping on a garden hose. This happens night after night, and the body cannot simply ignore it. Research confirms extreme cervical rotation reduces blood flow velocity. Stomach sleeping also compresses the rib cage during breathing. Every breath fights against the mattress and diaphragm cannot descend fully. You never reach full tidal volume and oxygen intake drops. For older adults with hypertension, this becomes a cumulative issue. Stacking multiple pillows under the head creates similar problems. People do this for acid reflux, snoring, or sinus issues. But excessive elevation pushes the head forward and chin downward. This forward bend, called cervical flexion, compresses arteries again. The internal jugular vein drainage also gets partially obstructed. Pressure inside the skull builds, and waist clearance is compromised. You wake up with brain fog and heaviness behind the eyes. The simple correction is using only one properly contoured pillow. Right side sleeping matters, especially with cardiovascular history. Side sleeping is generally good, but direction affects the heart. Lying on the right side compresses the inferior vena cava. Blood return from the lower body becomes restricted at night. The heart has to work harder against reduced preload constantly. For those over 60 with heart issues, this adds real strain. Patients with heart failure instinctively avoid right-side sleeping. Sleeping in a tightly curled fetal position also causes issues. Lungs get compressed and every breath becomes shallower. Blood vessels in hips and knees get bent and circulation reduces. Neck flexion adds the same problems as discussed earlier. Late eating and alcohol close to bedtime amplifies all risks. After a large meal, blood shifts toward the digestive system. Alcohol as a vasodilator causes blood pressure to yo-yo at night. This disrupts the natural nighttime blood pressure dip badly. Left side sleeping is the most evidence-supported position. It aligns with the heart natural orientation and improves flow. The glymphatic system clears brain waste better on the left side. It helps remove amyloid and tau proteins linked to decline. For those who cannot sleep on the side, elevation helps. Raising the upper body 15 to 30 degrees is beneficial. It reduces intracranial pressure and keeps airways more open. Adding a pillow under knees creates zero gravity posture. Your sleep environment also shapes cardiovascular recovery. Keep bedroom temperature between 65 and 68 degrees. Avoid blue light from screens after 9 p.m. at night. Use white noise or earplugs to prevent microarousals. An overnight pulse oximeter can track blood oxygen levels. If oxygen drops below 92%, consult your doctor. Your stroke risk does not stop when you fall asleep. The midnight to dawn hours are critical for your heart. Pick just one change tonight and make it consistent. Switch to left side or elevate your head 15 degrees. Stop eating 3 hours before bed or use one pillow only. Small nightly changes compound into real health benefits. Drop a comment and share which change you will try first. If this discussion helped you, hit the like button. Share it with loved ones over 60 who need this information. Subscribe my channel, Senior Wellness Hub, right now. Next week, 5 early morning symptoms will be discussed. These symptoms appear in the first 20 minutes after waking. They are often dismissed as normal aging but may be warnings. Sleep smart, protect your brain, and take care of yourself. This is the Wellness Doctor from Senior Wellness Hub.